Good evening, everyone. Today we are going to discuss the questions of week 12, previous year assignment questions. Please mute everyone. Please mute your audios. I think some yeah. Okay. So yes, Uh, today is not the last interactive session, but today is the last set of questions I have for you people. Next week, we'll be discussing revision questions. That is, I'll prepare a set of questions from each week and I'll mix them, and we'll have a set of revision questions so that you can revise all the topics of the 12 weeks, whatever we discussed till now. Okay, so next week is very important for from the exam point of view, so be there. And since the last 2 weeks we are having this problem that whatever questions I am discussing, it is already given as an assignment to you people. So I'm not sure today the questions are matching or not. If it is matching, just do it one more time as a practice question. Like, it can't be helped, those set of questions were given in previous year questions as well, so I can't change it. Okay. Okay, so I think we can start. Today's questions are very direct as well, so fact based questions. We'll start with the first question. Everyone knows the drill. I'll show you the question. You can take your time and answer, and then and I'll then tell you the correct answer to the question. Okay. So first question: what does the y-axis show in the length for age percentile growth charts? Length in meters, length in centimeters, age in years, age in months. Everyone can answer in the chat box. Is this a repeated question by any chance? This is a new one. Okay, but like week 12's lectures is related to growth charts. Age, is it? Okay, everyone is answering, so I think okay, great. And thank God for the last week we have a new set of questions for you guys. I think previous 2 weeks the questions were same. I don't know why, but that's okay. What does the y-axis show in length for age percentile growth charts? Option B, is it? Everyone is seeing option B. Okay, let's see if option B is the correct answer. Yes, option B is the correct answer. Length in centimeters is for the y-axis given in length for age percentile growth charts. Move on to the next question. What is the point where the two extended lines from the x and y axis intersect called? Length point, nutrition point, plotted point, or growth point? Today I think we have 25 questions to discuss. We'll wind this up quickly so that you guys can have time to prepare for your exams. And next week, please be prepared with all the questions of the 12 weeks. We got these questions in the last week, is it? Okay, whatever it is last week, this week, new, old, just attempt it for today. Okay? If you know the answers, well and good, just practice it once again. For next week, I am telling, please be prepared with all the lectures, revise all the lectures and the questions given for those lectures. Next week will be our final interactive session, and we'll discuss some revision questions throughout the weeks. Okay? Okay. So the correct answer is C. I think everyone has given the correct answer. The two extended lines from X and Y intersect at plotted point, right? Okay. The curved colored lines on percentile growth charts show which percentiles? Second, 10th, 75th, and 97th. Third, 5th, 50th, 85th, 97th. Third, 15th, 50th, 75th, and 95th. Second, 15th, 50th, 75th, and 97th. I think these questions are discussed in the lectures. So I hope everyone knows the answers. Let's see. B is it? Let's see if B is the correct answer. Yes, B is the correct answer. So the uh, colored lines on the percentile growth charts show third, fifth, 50th, 85th, and 97th percentiles. Fourth, what is the average birth length of a girl in centimeters? 49, 35, 54, 60. Birth length. Read the question properly and answer. Fact, ma'am, the set that we have to submit this week has tricky questions which are not readable on the screen shared during the lecture. Please share those in the next week. Not readable on the screen shared during the lecture means, okay. Okay. But then you need to send me those questions which you find tricky so that I can discuss it next week. Will you be able to do that? Yeah, you can mail me. I'll write the mail ID on the chat box. Okay, so let's see what is the correct answer to this question. The correct answer is A, 49. centimeters is the average birth length of a girl? What is the average birth length of a boy in centimeters? 40, 50, 60 or 70? Okay. B, 50 centimeters. Let's see. Yes, B is the correct answer. So the average birth length for a girl is 49 centimeters and for a boy is 50 centimeters. We'll move on to the next question. What is the average length of a 6-month-old girl in centimeters? 60 centimeters, 66 centimeters, 76 centimeter or 86 centimeters? B. Okay, let's see if B is the correct answer. Yes, average length of a 6-month-old girl in centimeters is 66 centimeters. What is the average length of a 1-year-old boy in centimeters? 70 centimeters, 76 centimeters, 80 centimeters, or 86 centimeters? B, 76 centimeters. Okay, let's see if B is the correct answer. Yes. So the average length of a 1-year-old boy in centimeters is 76, while for a 6-month-old girl was 66 centimeters. The average weight of a child is along which percentile line in the weight for age percentile growth chart? 10th, 15th, 50th, 75th. Start answering. C. Let's see if C is the correct answer. Yes. So the average weight of a child along which percentile line in the weight for each percentile growth chart is at 50th. 50th. In the percentile line it is at 50th. Okay. What is the average birth weight of a girl in kilograms? In kilograms. Okay. 2.2, 3.2, 4.2 or 5 kilograms. 3. Okay, let's see if B is the correct answer. Yes, so the average birth weight of a girl in kilograms is 3.2. What is the birth weight of a boy in kilograms? 2.3, 3.3, 4.3 or 5 kilograms? Okay, let's see if B is the correct answer. Yes, so the average birth weight of a boy in kilograms is 3.3 kilograms. On to the next question. What is the average weight of a 6-month-old boy in kilograms? 7, 8, 9 or 10 kgs? Done? Some are saying A, some are saying okay. Let's see what is the correct answer. The correct answer is B. 8 kgs. The average weight of a 6-month-old boy is 8 kgs. Moving on to the next question. What is the average weight of a 1-year-old girl in kilograms? 7, 8, 9, 10. C 9 kgs. Okay. Okay, let's see what is the correct answer to this question. It is C 9 kgs. The average weight of a 1 year old girl is 9 kgs. What is the average weight of a 6-month-old girl in kgs? 7.3, 8.3, 6.3, or 9.3? These are very confusing questions. You need to remember the age along with the weight, and it's for a girl or a boy. Okay. Okay, is it A? Let's see if A is the correct answer. Yes. So the average weight of a 6-month-old girl is around 7.3 kgs. 14th. In the first week, what should be the average weight gain of a boy per day in grams? 25.5 grams, 28.5 grams, 30.5 grams, or 31.5 grams? Some are saying A, some are saying B. Okay, let's see. Everyone is done. The correct answer is B. The average weight gain of a boy per day in grams for the first week is around 28.5 grams. So this first week is after birth. What should be the total weight gain of a boy in the fifth week in grams? 200 grams, 300 grams, 400 grams, 500 grams. Total weight gain it is asking by fifth week in grams. Okay, let's see what is the correct answer. The correct answer is B. The total weight gain for a boy by the fifth week in grams should be around 300 grams. Moving on to the next question. Growth chart shows a sharp decline after 6 months of age. What should be a possible reason? Complementary food is not started after 6 months of age. Mother is underweight. Baby is breastfeeding frequently, or baby is moving too much. A. Let's see if A is the correct answer. Yes. So there can be a sharp decline in the growth of the baby after 6 months of age if complementary food is not started for the baby. Breastfeeding exclusively won't be enough for the proper growth of the baby after 6 months of age. Complementary food is needed. We have discussed this many times. When is a sharp incline in the growth charts risky for babies? If the baby is breastfeeding frequently, if the baby is being fed animal milk or formula, if the baby is being fed expressed breast milk, if the baby is breastfeeding for longer duration. B. B is the correct answer. Let's see. Yes, if the baby is being fed animal milk or formula, there can be a sharp incline in the growth of the baby, which can be risky for the baby as well. Okay. Okay, moving on to the 18th question. A girl child whose weight was 3.2 kgs at birth suddenly starts dropping to the 15th percentile line at 1 month of age. What could be done to increase her weight? Teach effective breastfeeding technique, start formula, start animal milk, start complementary feeding. Read the question carefully and then answer. Okay. A. Yes. Let's see what is the correct answer. It is A. Because the baby is only of 1 month of age, and if the uh, weight is dropping severely after the birth, then it is definitely due to inefficient breastfeeding, and hence teaching effective breastfeeding technique would help to increase the weight of the baby. Next, eggs, chicken, Dash and dash are excellent sources of protein. Fish and meat, dals and pulses, dals and grains, fruits and vegetables. A. Let's see if A is the correct answer. Yes. So eggs, chicken, fish and meat, these all are excellent sources of protein. Next, sorghum chapati has dash grams of fiber. 3 grams, 1 gram, 6 grams or 8 grams. A, 3 grams. Let's see if A is the correct answer. Yes. So sorghum chapati has around 3 grams of fiber. Moving on to the next question, 21. Salted scale is a electronic scale, digital scale, spring hanging scale, electric scale. So, okay, let's see what is the correct answer to this question. It's a spring hanging scale. Salted scale is a spring hanging scale. Why is a clean dry towel placed on the baby tray before weighing the baby? To increase the baby's weight, to keep the baby still, to fit the baby in the tray, to reduce the chances of infection and a drop in body temperature. D, right? Let's see. Yes, D is the correct answer. So before, if we want to weigh the baby, we put a clean dry towel on the baby tray before weighing it, because the tray can lead to infection and drop in body temperature. That's why we use a clean dry towel. How to check the accuracy of weighing scales? By weighing yourself regularly, by putting in new batteries every week, by weighing fruits and vegetables, by weighing standard known weights. Very easy question. D. So we can check the accuracy of weighing scales by weighing some standard known weights, by weighing weights whose weights are already known, right? What helps in passing messages quickly through the brain cells? Myelin sheath, protein covers, protein sheath, or glucose molecules? It is myelin sheath. It helps in passing messages quickly through the brain cells. It is present in the axon of the neuron, right? So, this is the last question of today's session. What does high weight gain during pregnancy in mothers who are not underweight increase in babies? Babies' muscle percentage, risk of childhood obesity, babies' IQ, babies' resistance to diseases. Let's see what is the correct answer to this question. Is B. If the mother gains weight during pregnancy, it can be a risk for the baby, that there is a risk of childhood obesity for the baby. Okay, with this, we are at the end of our today's discussion. Next week, we'll meet and we'll revise the questions for all the 12 weeks. Okay, I think I'll prepare a set of around 30 questions or so by mixing the questions from all the weeks. And please come prepared, revise all the lectures and the questions we have practiced till date, your present year assignment questions, your previous year assignment questions, everything. Okay, okay. Should we disperse? Anyone wants to share their scores? They can. 25. How much out of 25? Has anyone counted? 24. Good. Very good. Okay. 24 is the highest. Good. 24 is a very good score. Okay. So we'll disperse for today, and next week will be the last session. So if anyone has any doubts, please come prepared and we'll discuss revision questions. Okay? Okay. Thank you everyone. Okay. Thank you everyone.